My name is Stephanie Baldwin. This is my Advanced Health Assessment Head to Toe Assessment.
Hello.
Hi, I'm Stephanie.
Hi.
I'm going to be a nurse practitioner today. I heard you're here for a physical, is that correct?
Yes, ma'am.
Can you tell me your name and your date of birth?
Scott Carlson, 12/11/66.
Are you allergic to any medication?
No, ma'am.
Any foods?
No.
Okay. I see that the nurse got your vital signs. Any questions about that?
No, ma'am.
I see that that's just a little bit high, but she said she took it a few times. So it was high.
Yeah, I get nervous when I go in to see the doctor.
All right, understandable. Okay, I'm just going to wash my hands real quick. And I already reviewed your past medical history. It seems that you're healthy. You have no medical problems,
Nobody.
Not taking any medications?
Yeah, not me. Nobody on my family side of the family. So.
One nurse well. Okay. So I'm going to proceed along and I'll tell you what I'm doing. And if you have any questions, just let me know. So the first thing is that I'm looking at him and I'm noticing that he has good muscle tone. And when he walked in the room or walked down the hall, I noticed that he had good gait. And I'm looking at him right now. He has good facial symmetry. Can you see on the camera? Okay. So I'm going to observe, and so he's got good facial symmetry. I'm noticing that he's normal cephalic. His hair is evenly distributed. I don't see any signs of pediculosis. There's no lesions. His face is free of lesions. The outside of his nose is midline. There's no deviations in the eyes, no drooping. Sclera is white, no discharge. So on physical examination, I see that he looks healthy, well nourished, and he's got a good affect. Can you tell me what today's date is?
Oh boy, today is the.
You know the day.
It's Thursday.
Okay,
it's Thursday the 9th of October.
Good. And of course you know who you are because you told me who you were. Do you know who the president is?
Obama.
Okay, so he's oriented ×3, person, place, and time. I'm going to proceed, so I've done the visual inspection, so I'm going to proceed to go ahead and examine his eyes and his ears and do some cranial nerve testing at the same time. So first I'm just going to look into your eyes. Okay, and we're going to do the red light reflex to make sure that that's present. If you can just look at the wall over there for me. Okay, and do you see the red light reflex? Fund eye is clear. Okay, now I'm going to check for accommodation. Pupils are equal and reactive. Can you do me a favor and can you read that on top of that calendar?
Firefighter, October 2014.
Very, very good. Okay, so now I'm going to do examine the extraocular movement and test cranial nerves. Can you do me a favor and follow my finger? And then right here in the middle. There you go. So no extraocular movements. He has convergence. So no eyelid drooping. We're going to go ahead and look into the ears now. I'm noticing the outside of the ears. The auricles look fine. There's no lesions, no uncles, no deviations from that. The outer ear looks fine. I'm going to examine the inside of the ear. I can visualize the tympanic membrane. It's silver and pearly. Same thing with the other ear. External examination. The auricles look good. No lesions, no uncles. There's not rather. Tympanic membrane looks silver and pearly. And now I'm going to conduct a hearing test. I'm going to whisper something in your ear, and you tell me what it is.
Gummas.
Okay, so that's called the whisper test. We tested the acoustic nerve. Normally I would have a tuning fork. We don't have one available, but I would bang it on my hand. I would place it on top of his head, called the Rhine test, and that would test air conduction and whether you heard on both sides. Then I would bang the tuning fork, place it on the mastoid process, and let me know when you stopped hearing it, and that would tell us when bone conduction test. So we'll just say that you passed those and that you heard just fine. I'm now going to examine the inside of the mouth. But first of all, I'm going to have you do a few exercises to test cranial nerves again. Can you do me a favor and stick out your tongue? Can you try to touch the tip of your nose? Can you smile? Can you puff out your cheeks? I'm going to feel the tympanic, Temporomandibular joint. Can you clench your jaws? Very good. Can you swallow? All right, let me take a look from the inside of your mouth. Mucosa is pink. I need a tongue depressor, but I'm trying to look at the tonsils.
Don't have my tonsils.
Oh, well, there you go. I'm pretty good at this stuff. I kind of know what I'm doing here, don't I? All right, uvula is midline, and you have a good swallow, so go ahead and swallow again for me. Now, I'm going to test the nerves on your face. Can you tell me, I want you to close your eyes and tell me if you feel this or not, okay?
Yes. Yes. Yes.
And in the actual testing for that cranial nerve, you would do sharp and soft, but I'm not going to poke you, but I'm just going to test and make sure that you have sensation. If you didn't have sensation, we would do further testing with the sharp and the soft, okay? So the tonsils are absent, mucosa is pink, moist, he has all his teeth, dentition looks good. So now I'm going to start palpating. Now that I've done kind of the examination, I'm going to palpate the sinuses. Let me know if you feel any pain. Does that hurt at all?
Yeah.
Okay. Now I'm going to move to the lymph nodes. We're going to do preauricular, postauricular, anterior cervical, subtonsillar, submandibular, submental, cervical. Can you turn your head to the right? Deep cervical chain. Turn your head the other way. Deep cervical chain. And the clavicular. So all his lymph nodes are non-tender, none of that hurt. Non-tender, non-palpable. Do me a favor. Push against my hand. Wait, turn your head against my hand, sorry. Turn your head against my hand. Okay. Now shrug your shoulders. All right, so all cranial nerves are intact. Do me a favor and squeeze my fingers. Now push against my hand. All right, very good. So you have normal motor strength plus 3. We're going to go ahead and test out your pulses real quick while we're here. Radial pulses are intact. Brachial pulses are intact. We're going to defer the femoral pulses. I'm going to check the pulses on the back of your legs. These are usually painful, so I'm not going to squeeze. But we're going to say the popliteal is intact. We're going to do the tops of your feet, which means you need to take off your toes. Or take off your toes.
I would prefer
Well,
not to, but that's okay.
That would be the shock of my career if you did. I'd have to bring everybody in to check it out.
Right? I can take my toes off.
So the tops of your feet, so we're doing your tibial, or pedal, and then your posterior tibials. And those are good. And so while I'm here, I'm looking at his feet, and he's got good color, no lesions, toenails without any growth. They look pink. Nail beds look pink. So we'll go on to that once I have him laid down. I'm going to wash my hands again because I touched your feet.
Gotcha. And move my shoes out of the way.
Okay. So now I'm going to take a listen to your carotid arteries, and then I'm going to take a listen to your thyroid, and I'm also going to feel your thyroid, okay? Negative for carotid bruise, negative for thyroid bruise. I'm just going to palpate your thyroid gland. 2. Thyroid is non-palpable. That didn't hurt at all, did it? Okay. Then I'm going to ask you to take your shirt off. So I'm doing an inspection of the chest. He has no lesions. He just has one scar there. What's that scar from?
I had an old cyst as a teenager. They removed it. It was just a sebaceous cyst.
Okay. So he's got symmetrical. I'm observing his respirations. I guess I would have taken his respirations while I was assessing his pulse, not letting him know so that he maintains a regular rhythm. So he does have symmetrical expiration and inspiration. I'm going to go ahead and start listening to the heart first, and then I'll proceed to the lungs. So I'm going to listen into the landmarks of the heart. So first I'll be listening to the aortic, which is second intercostal space, left sternal border. Tricuspid, second intercostal space, left sternal border. Move down to the aortic, pulmonic, tricuspid, which is the fourth intercostal space, and then the mitral, which is fifth intercostal space, mid-clavicular line. So that's going to be about there. S1 and S2 at the aortic and the pulmonic are less. S1 is less than S2. At the tricuspid, S1 is equal to S2, and at the mitral, the S1 is greater than S2. So I've listened to his heart sounds. He has regular rate, regular rhythm. I'm going to go ahead and palpate the apical pulse. I do feel a good PMI. It's not bounding. Pulse is about a +3. So then I'm going to move along to the respiratory. And meanwhile, I'm still doing a skin assessment, and I notice on his bilateral extremities, there's no lesions, but he's got good muscle tone. His color is for his stated ethnicity. I'm going to move around to the back so that I can do some palpation. You let me know if any of this hurts. So I'm going to palpate the respiratory area. The lung fields. Any pain?
No.
Okay. Any pain when I do that?
No.
Okay. Now I'm just going to tap it. I'm going to listen. I'm going to hear resonance over the areas of the lung field. When I do hit the liver, when I hit the liver, I'm going to hear some dullness. When I have you lay down, I'm going to try to palpate the edge of the liver. We'll see if we'll do that. Sometimes it's pretty painful, but right now I'm just going to percuss after I've palpated. Can you raise your arms for me? And I'm going to go to either side and compare. Okay, now put your arms down. We're going to come up here. And then if I move down, I'm going to hear some dullness. So it was a little louder, and you'll just hear some dullness. So now I'm going to take a listen to his lung sound. I'm going to have you take a deep breath, and then I'm going to have you take some breaks, okay? Deep breath in and out. In and out. In and out. In and out. Okay, let me let you take a break before I pass out on me. It's usually about that time that I get dizzy. Okay. Take a deep breath. And deep breath. Okay, lung fields are clear posteriorly. I'm also going to look at chest expansion. Can you take a deep breath? My hands do move symmetrically, so there's no deviation when he takes a breath. Up here, I'm going to hear the bronchial, vesicular, and vesicular sounds all through the lung fields, and he does have clear breath sounds. Listen anteriorly. Deep breath. Deep breath. And one more for breath. All right, sounds good. And you can also take lung sounds at the apex up here, and you would move on to a more thorough examination if there were any findings that were out of the ordinary. So that's it for respiratory, cardiac, cranial nerves, and then just the physical assessment. So I'm going to have you lay back. We're going to do an abdominal assessment. And while he's laying back, I'm going to notice and see if he's got any jugular venous distension. So I'm going to observe for his, and have him just get up just a bit. There you go, now lay back. And at the same time, I'm going to observe his jugulars, see if there's any JVD. He's negative for JVD. So I'm going to inspect the abdomen. The abdomen appears free of lesions. It's flat. And so I'm going to move on to auscultating the abdomen in all four quadrants. One here, 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 one here. And there's actually 9 in the abdomen, but you just auscultate 4 to evaluate valve sounds. So now I'll be palpating. First I'll do some light palpation. Let me know if any of this hurts. I'm going to palpate in 4 quadrants. And I'm going to observe for any rebound tenderness. Does that hurt? No rebound. Tenderness. Now I'm going to go deep palpation. I'm going to attempt to palpate the edge of the liver. It's going to be kind of painful. And then the spleen will be on this side. So I would go deep palpation. And I do the edge, the liver border. Here's the spleen. Continue to push. And if I was going to attempt to capture a kidney, I would grab the flank and I would press and attempt to capture, but that's pretty painful. Let me do the other side. So the abdomen is non-tender, bowel sounds are normal, liver edge is palpable. Patient doesn't complain of any pain. So that would be it for the abdominal assessment. The genitals are deferred. Ideally, he would have a gown on, and I would be able to see from here, from his legs down. But we'll pretend. So I'm observing his legs. There is no edema. I'm going to push my fingers, just visible edema, and I'm going to push my fingers on the shin, and I don't see any pitting edema either. As I mentioned before, his pulses are intact at a +1 on his feet. He doesn't have any wounds, any ulcers, any lesions on his feet. Can you do me a favor and rotate your ankles? Can you bend your knees up and down? Do me a favor and try to push up against me. Push up against me. Lower bilateral muscle strength is good. It's intact. Now we'll move on to, I'm going to test your reflexes. I'm going to use the edge of the stethoscope since I don't have a... So right now I'm just going to assess for clonus, which would be indicative of an upper motor disease. And he is negative for clonus. Okay, now I'm going to stroke the bottom of your foot. It's going to tickle. He's very tickled. Okay, we're going to assume that he's got a negative Levinsky. I think I'm going to have, you're young enough that you can do this. Go ahead and sit up for me again. Oh, yep.
Thanks.
You're welcome. Now I'm going to test your reflexes in your knees. Can you sit back so your legs dangling for me? Thank you. Reflexes are good. We're going to test the other reflexes. Okay, now this one's it's very fun. It's called Achilles. So if you want to turn back, I want you to kneel.
Okay.
I'm here like this. Sorry.
Okay, sure.
Okay. Positive Achilles. If you want to go ahead and sit back down. Let's do a couple of tests real quick. Can you touch your fingers to your thumbs like this, back and forth? Very good. That's another good one. I think I've done them. I want to go through it. Hold on. Facial. Did skin inspection. Oops, let me do capillary refill. Cap refill is good. We did all your pulses. We did the heart. We did the lungs. We palpated with the cuffs. All of that. Do me a favor, stand up, close your eyes. I'm going to do a Romberg test, and this is just going to see if he has an equilibrium problem. Hold my hands up. He's got minimal swaying, which is expected finding. Go ahead and open your eyes. Can you lift one leg? Okay, lift the other leg. Can you bend over so I can go ahead and check out your spine? So no scoliosis. Let's see, we did the shoulder shrugs. Okay, I think I'm done. That concludes my head to toe assessment.
I did have one question
Sure.
there. Is there any worry that we have to deal with that Ebola thing? Is it still anybody coming in from the country from West Africa, or is it?
They have screening in place for anybody coming from areas of concern, like Africa and Liberia, where they are stopped at the airport and tested for fever or any flu-like symptoms. Here in the United States, Ebola is not a big of a concern because we have advanced healthcare and simple antibiotics will actually be a way to catch it in time. So right now it's not a big concern, but we are screening for patients that have had contact with people that have traveled to that foreign country and not. And of course, anybody that reports flu-like symptoms that comes from a foreign country, then we are definitely on alert. But no, it's nothing to be afraid of. Just, you know.
Okay.
Okay.
Thanks.
You're welcome.
Appreciate
Thank you,
it.
Scott. Appreciate it.